Welcome to the EAU podcast series, Women in Urology, Dare to Thrive. In this 9th episode, the Urology Resident Perspective, we are joined by Dr. Kim Pauwaert and Dr. Francesco Ripa. Together, they will discuss the realities faced by women residents in urology, from training challenges to opportunities for empowerment and professional growth. Join us as we embark on this informative journey.
Hello to everyone. Thank you for this kind invitation. We are starting today the podcast for the series Women in Urology. And today's recording will be about the urology resident perspective. And I'm very happy to introduce also my friend and colleague, Kim Pauwaert.
Kim Pauwaert. I'm just finished residency actually last year in Ghent University Hospital in Belgium. And I'm now starting as a senior clinical fellow in the NHS system. So I'm freshly graduated, and I do think I have a lot to say about the resident's perspective of women in urology. But I think you have some quite good points as well, Francesco. Can you introduce yourself?
Yeah, sure. Thank you, Kim. I'm Francesco Ripa. I'm from Milan, Italy, and I'm a freshly new full urologist. I finished my training last year, and I had the opportunity of working both in Italy as a resident for my training and in the UK. In fact, I've spent a couple of years in London and 1 year in University Hospital Southampton. So now I'm back to Italy, and I think, of course, maybe this can enrich the conversation about differences among not only my perspective as a male urologist, and yours as a female urologist, but also among different systems and different countries in the same association of European Association.
I think we could really have a nice conversation and chat like that.
Sure. So we had a quick chat about this couple of weeks ago, and we started talking about, again, the department we are currently working in, or for you used to work until very recently. So how would you describe the gender ratio and the gender situation in your department in Belgium? And then we can chat about what you can expect in the UK.
Yes, thank you. Like in Belgium, it's said that only 70% of all urologist consultants are women. However, during residency, I have seen that changing. So a lot of residents are now currently female. When I started 7 years ago, I think it was like 25% or 30% of residents were women. But nowadays, I looked up the numbers and I see that 60 to 70% of all residents currently in Ghent University Hospital are female. So urology is really becoming more and more female in Belgium. And I have the impression still a lot of consultants are male. In Ghent University Hospital, I think it's half-half. But if you look to the other hospitals, it's more male than female. But the times are changing. Do you have the same impression?
I have to say, Kim, I've got the same feeling in terms of differences between probably our generation, but also the younger generation of doctors that are coming just after us. Compared to the previous generations, my feeling is that maybe back in the days, it was really rare for a female doctor to start a career as a urologist. It was a very difficult choice, very demanding and very controversial for some aspects. Nowadays, I'm really happy to see a lot of female medical students applying for the training in urology. It's much more appealing, and I'm happy to have the contribution of these young female doctors. Would you say, probably we were talking about this, maybe back in the days, it was also difficult to have some role models and mentors. What do you think about that?
Indeed, I think having a mentor where you can see yourself somewhere in, like a person that stands up for you and that's a little bit similar, is really important. So I think if there will be more female consultants and more female mentors, it will be way easier for female students to see themselves doing that role further on in their career. I had some female mentors where I really looked up to, but I had male mentors as well. So I think you're not only dependent on female mentors, but I think it can help and to see that women can combine work, family, and be having a good career as well. So having these mentors in urology, I think it's really important as a young woman.
Yeah, I remember when again when we had the first meeting that you were mentioning that one of the most probably difficult part of being a young female training urologist was to explain to your family and to your friends that's the choice that you made. So what kind of difficulties did you encounter during your training and pathway in terms of having to explain to someone that this was your choice and you were very happy about this?
Yeah, in the beginning, my family thought this was a really wrong choice. Not that they were not supportive, but they thought it was all about male patients and they didn't see like a female urologist could be the future. That they adapted quite quickly, I think. They saw that I really liked it and they saw the potentials in it. But during residency, it was really demanding. You have to work a lot of hours. You have a lot of on calls. And sometimes it's difficult to explain to your family that you choose to have a big career and that you do everything for work and that family sometimes have to wait for it. Not always. You have to find the balance. But I think it's always more difficult to find a balance as a woman than as a male. I have the impression, I don't know how you're feeling about this, Francesco, but as a woman, you have to keep up with all your family members. You have to clean the house. You have to have a big career and you have to get all the balls up. And actually, I have a husband that is really caring for me and does a lot. I cannot be upset about that. But still, they have some things that they want from women. And that's sometimes difficult to get it all in.
Yeah, I guess that's your superpower. I mean, women can do everything. Sometimes I feel a bit sorry to hear women being questioned about the choice they've made, about the career, because, you know, it's not fair to ask someone about very personal choices like family choices or whether or not to have children. Maybe we do that in a friendly way, but I can feel the pressure from your side. And probably it's not easy also to reconcile this kind of very demanding work, as you were saying, long hours and a lot of commitment. Also, we know that this kind of job that we do is also extra hours. So we do the clinical part, also some extra, you know, like research and database and data collection. So it's 100% commitment. First of all, do you have any regrets in your choice? And do you think for the future, if you would like to have a family, do you think that would be manageable, or do you think you're going to struggle with that?
Do I regret my choice? No. I will not be another doctor than urologist. I really like urology. I really like my work. I really like the combination between research and clinical work. And I think I can sort it all out in the future to get a family in as well. I think we should manage more in the future the differences and balance between work and private life. But I think after residency and busy on calls, if these go away, it will be much better. I always think it will be better. It won't be 100% better, but it will be better than in residency. I hope so, because in residency, it's also known that residency has a quite big impact on pregnancy complications.
Something you were mentioning, and actually, it's not the first time I've heard about this. I didn't know anything about this until very recently. And it's kind of impressive because I was at a congress in London, and actually there was a presentation about this, about all the complication that a pregnancy in a female surgeon can encounter in terms of higher risks. Is that something you've also studied anything about?
Yeah, I'm not really studying about, but I'm thinking about it. I saw a presentation on the EIU, I think it was 2 years ago in Milan, where they say that 1 in 3 urology residents has suffered a miscarriage. And this percentage is remarkably higher than in the general population. In the general population in Belgium, I think it's 1 in 6 or 1 in 5. And when you have 1 in 3, it's way more. Would it be the stress factor? Will it go away when you become a consultant? I don't know. And they also managed that 1 in 3 or 35% of pregnant urology residents encounter a major obstetric or postnatal complication. So I think these numbers are quite high, and we should think about it when we have female residents, that they maybe should slow down, even if they are not willing to slow down, because I know myself, I won't slow down.
I mean, the starting point would be probably to raise the awareness of these issues.
Mm-hmm.
And we have to consider actually a few different risks. I mean, there are biological risks linked to the environment you're working, radiological risks, especially if you're doing endourology. Also physically, standing in a theater for long hours and the stress related to the job itself. It's a few things that combined together maybe can actually affect the outcome. So we need to be aware of this and to implement some strategy to prevent complications.
Do you think of some things that we can implement to make female residency more easy? No, not more easy. I don't think that we have it harder than males, and I don't think like we have to have another treatment. Nothing about this, because actually I'm believing in an equality between male and female. But do you think of some things that we can improve?
Yeah, I found some differences between, for example, Italy and the UK. The opportunity of setting your own work schedule, your weekly work schedule. Maybe we can improve that, because in the UK, according to your commitments to your family, or if you are busy with your childcare, you can in some ways adjust your work schedule to work with everything else, Whereas in Italy, I feel like it's much more rigid. Like you have to do this and you need to sort it out yourself. You don't have any support. You need to find some solution between you, your family, or whoever can help you out, but you need to sort out yourself. I don't think this is fair. Maybe we can try to understand the needs of everyone and maybe come together to some better solution and some work schedule that can work better.
I think that's a good solution and a good opportunity, but I think we should have it for males as well, because sometimes a man wants to be with his family as well, not only a woman. I think that should be improved. And indeed, I'm just only 4 days in the UK, but I already saw a lot of work schemes and differences. I think Belgium has a little bit the same structure as Italy. It's more rigid. A lot of urologists are working 4 and 5 days, but still it's rigid. And I think we have to improve there, not only for women, but also for men.
And again, I mean, things are slowly changing because there will be much more female urologists, and we are happy about that. Obviously, again, maybe hospitals can provide a little bit more support in terms of helping making together, the job and the commitment to the job and the personal life outside in terms of maternity leave, paternity leave, and work schedule. Obviously, I'm also happy to see that a lot of female researchers are also getting on top positions in the university. I was mentioning to you that lately the appointed dean of the University of Milan is Professor Brambilla, who is a female researcher. Again, things are changing at higher levels in terms of governance, in terms of university boards. We need to give more space to women, not only in our everyday clinical practice, but also at higher levels.
Yeah, that's really important. And when this will change, I think the impression of having a male urologist is common will change for the patients as well. There will be a day, I think, that a female resident comes in the room with the old male nurse and they don't say to the male nurse, the doctor. I have had it a few times, but yeah, that's normal. They are not used to it. And I think in the future this will change because of more female positions in the government, more female positions in university, but also more female urologists. So I think for the future, it will be quite a change.
Things are changing also from the patient's perspective, as you were saying. I mean, they're not afraid of having a female urologist. They are not also ashamed of sharing personal symptoms and stories about their not only urological symptoms, but also about their sexual life. And I think, again, there is much more awareness nowadays that we got brilliant female doctors, we got brilliant urologists, and we got brilliant andrologists as well. We can expect all the best.
Yeah, I have the same impression. Thanks for the nice chat, Francesco. It was nice to discuss the female position in residency and urology. And I hope this will change over time, that more female urologists are coming at the stage in Europe.
Brilliant. Thank you. Thank you so much, Kim. And thank you to the EAU and to Amelia Pietro-Paolo for the invitation.
Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.